those stories with scientists using these big fancy robots? Well, that does happen, but most of the research that gets done in your day-to-day lab is actually really low throughput. So we're testing just a few samples at a time, working with a single protein at a time, this sort of thing, rather than doing those high throughput things like high throughput screening, where you see those robots being used when scientists want to test a lot of different things at once. Now, there's some different reasons for this. One is that those robots are expensive, and the other is that when you do those things like high throughput, you actually often lose a lot of the sensitivity and the accuracy. And so even when people find things through those high throughput methods, then they often follow up with lower throughput follow-up experiments that confirm the findings from those higher throughput things. Sometimes we refer to the additional follow-up experiments. We can say we have like orthogonal techniques. And so basically you're testing the same thing in a different assay, a different test, and that'll give you a little bit more confidence that the result actually was real. One of the places you see high throughput used a lot is high throughput screening, or HTS. And so here scientists, maybe they want to find a drug that targets some sort of protein, or they want to find a compound that binds to some protein. And so they'll test a large library of compounds. So basically a big collection of compounds. And they'll have them in things like really like massively weld plates. And so say this would be like really low throughput. Well, a single tube would be like the lowest, but then this would be like low throughput. This would be kind of medium throughput, and then you would have plates with even more wells, and so they get tinier and tinier, and these robots are using these microfluidics, and they have these tiny little amounts of liquid that they put. And they'll have these big screening libraries, and they'll test a ton of different things at once using these robots that can handle those tiny volumes and things. And then they might find like an initial hit. And so they say this one compound looks like it binds, and then they need to follow up with additional experiments where they're doing things more low throughput to really confirm that those results were accurate. One of the problems with these high throughput things is you're more likely to come across those kind of chance encounters that give you a false hit. And so you think something is actually a hit, you think it's actually binding, you think it's actually this thing, and it's not really. And so if you think about a technique that has a 99% accuracy rate, so if you test with single sample, it's really likely that it's going to be, your results will be accurate. But if you tested 100 samples, then it's really likely that one of those is going to be inaccurate. And so that's one of the reasons why you need to follow up with these lower throughput methods. Additionally, when you're doing a higher throughput method, say you're doing something like RNA-seq, as opposed to doing a lower throughput method like qPCR. With the RNA-seq, here you're often going to lose out a lot of the samples, whereas with the lower throughput method, there you're able to really target the samples that you want and make sure that you get the sample that you want and don't kind of have it hidden out by all the other samples due to bias in the techniques. And so there's different things where you can kind of optimize things. If there's certain things that you know you're looking for, then you can go with a lower throughput method that's going to be more sensitive and more accurate and allow you to tailor the experiment more to what you're looking for, as opposed to a higher throughput method, which is great for finding potential leads, but then you need to follow up. With any sort of experiment that you're going to do, you're going to want to make sure that you've got negative control and positive control. So a negative control, this is like, doesn't have any protein, it doesn't have any drug or something like that. And this is going to be so that if there is no signal, you shouldn't see any signal. And then a positive control would be something that you know should give you a positive signal. And if it doesn't, then you've got problems. And so you should always have those controls so that you can compare to and make sure that your experiment is working and that the signal that you see is actually signal that's more than just the background noise that you get from with that your negative control. In general, that's not always true. The higher the throughput, the lower the accuracy and the lower the sensitivity, as well as kind of you have to worry more about biases that come in from the technique itself, as opposed to a lower throughput method where you're really able to tailor it more to the sample that you're looking for.